Happy Saturday, everybody. Welcome to today's installment of Home Solutions. This is Dennis Purvis, live and direct here from the Mix 1041 studio. Hope you guys are having a wonderful weekend. I know it's cold out there. As we start this new year, happy 2024 to all of you. Thank you for listening. Thank you for tuning in this morning. We appreciate everybody that listens, that plays these back on Facebook, watches the YouTube. However you're watching, however you're listening, thank you for your support. As always, we're brought to you by Pro 93 Home Solutions, which I'm a little partial to. It's my company and my buddy Jesse Matthews. We just want to say Happy New Year to everybody out there, and thank you for a wonderful 2023. We got bigger and grew again last year, and that's only because of all the folks out there that have given us a chance to partner with them in the projects in their homes. Remember, we're your friendly local neighborhood contractor. We do everything from repairs to remodels to build you custom house. Whatever you're looking for, we'd like to partner with you. So please give us a call. Estimates are always free, 458-4135, or pro93homesolutions.com. It's that simple. Hit the Contact Us tab. That'll come to all of us. We'll get you on the list, get you out there to do an estimate. And don't forget our clean team. If you're looking for some light commercial or residential cleaning, we would love to come give you an estimate. Even if it's just for a one-time deep clean, maybe if the holidays are over, the family's out, and you need to treat your family to a nice clean house, and you don't really want to do it after all the holiday hullabaloo, give us a call. I'll have our clean team come out, give you an estimate, and get you cleaned up and get you ready to go for a new year and a new school year and everything else. Again, that's 458-4135, pro93homesolutions.com. So there's my shameless plug. Today I'm excited because I got two good friends of mine, and love what they do and what their business does. And it seemed pretty dang timely. I called Tim this week and said, hey, I need to get you guys on there. It seems like, and I'm just getting over being sick myself, but we talk about things that go with your home and your garden on this show. We're your area's only local home and garden show. Well, ain't much of a home if you ain't feeling well. And that's one of the things we'll talk about. Today we're going to talk about taking care of you, taking care of your family, taking care of your physical health. And so I've got Brian Fretwell, Tim Tatem from Direct Primary Care Associates here. Guys, welcome. Thank you for being here today.
Thanks for having us.
Thank you so much, Dennis.
So I called Tim this week, and it just seems, I'm getting over getting sick. Half of our crew is either getting sick, just got sick, or in the middle of being sick. If you got kids, it's even worse. And, oh, by the way, now everyone's going back to school. So it just seemed like a timely thing to get them on. I know I've seen the headlines in the papers, hearing on the radio. Steve was just talking about the other morning how the emergency rooms are all packed out and people in the hallways and no more room at the inn at the hospitals. The room, people waiting 24 and 36 hours in an ER just to try to get a room. And there's somebody said, well, I'd go to a different hospital, and around here it's kind of like, well, good luck. Where I don't know where you're going to go because they're all kind of in the same boat. So. So we'll get into what direct primary care and what makes you guys special here in a minute. But let's just jump right into this, Brian. I know you're CEO of the company, but you're also a medical provider. Mm-hmm. What are you guys seeing out there? We talked a little bit before we came on air about what's the reasons and how it's going on. What are you guys seeing? What's the state of play out there right now?
Everybody's sick.
Yeah,
just like you said. The interesting thing about what's happening in our community is really about 2 to 3 weeks before Christmas or before that Christmas break, things were beginning to ramp up. So what's ramping up? Colds, coughs, sniffles, developing into fever, chills, body aches, those sorts of things. And it has just caught fire. You can go to the CDC's website and do the flu surveillance. And they actually have a map, and it's really like a weather map.
Yeah.
And it's color-coded. And in that color code, it shows, really starting in South Carolina, moving west to Tennessee, north to North Carolina. Purple is the highest color they have. Purple is the hottest of the hot. That's where the majority, and they have a score in there, and I won't bore you with the boring details. Let's just say it changes to pretty color purple, and purple is the absolute highest that it can be. Tennessee right now, in the last 5 weeks alone, has maintained that purple color.
Oh.
So the good news is last 5 weeks we've been sick, right?
Yeah.
Well, no, I'm sorry. That's the bad news. The bad news is the last 5 weeks we've been sick. The good news is maybe another week or two, and we should see this drop off. But right now people are so scared, man. And that's why the emergency rooms are ending up with a lot of people. And, our goal really is to, treat those colds, coughs, flus, the common viral things as much as we can, at all the great, family medicine, walk-in clinics, all the places that do that routine care. We want to drive them there, those folks who are out there listening, and we'll talk more about what to expect and, the symptoms and that sort of stuff to free up the emergency rooms, because it is a problem in the emergency room. We have so many people who don't know where to go, who don't know what to do. Hey, I just need somebody to look at my symptoms. And, when you decide to go to the emergency room, and I think we can all equate to this, I think we can find some common ground in this, but when we decide to go to the emergency room, we've decided it's an emergency now.
Yeah.
And so when we go, we need that care. And man, to sit there, I can only think of sitting in an airport at Christmas or New Year's. Yes. Would probably be worse. But, past that, I think the emergency room rate's pretty high on that pain scale,
Yeah, and I feel like, we talked a little bit, like I said beforehand, how much of this, and Tim, you may be way on this too with your kind of counseling background, how much of this is we've kind of been conditioned by COVID that when we get, especially if you start getting that cough, we all got so scared a couple of years ago when you started getting that cough. Oh my Lord, am I going to be in a hospital? Am I going to be on a ventilator? When, back when we didn't know what we were, just, science was doing the best they could to play catch up with this thing. How much of the drive in people just jumping, maybe not even from an urgent care or their family doc, just going straight to the emergency room, is because they're that kind of fear of COVID?
Well, in 2020, the mental health community really kept a close eye on things. So East Tennessee, basically from Chattanooga to the Tri-Cities, there's an association that keeps track of things. And at that time, before COVID, 1 in 5 adults would report a mental health issue.
Yeah.
Now it's 2.5 out of 5.
Oh.
And so a lot of that is anxiety. And, anxiety is one of the most frightening things because it is real.
Yeah.
But it's more in your head. But you can't tell someone who's having anxiety it's just in their head. Mm-hmm. But it's real thing. So I think, you're right on. A lot of it's the fear thing.
Mm-hmm. Well, and I think too, as a business owner, I can tell you it's my first, because, we're in a business where we're in people's homes and people's businesses every day. Mm-hmm. And if it is COVID, I have a responsibility to our customers to let them know, hey, we may have somebody with COVID, but the same way if they have the flu. So I feel like I can tell you what COVID did. COVID changed me as a business owner, that I'm now pushing. I definitely want them to stay home. I don't want my guys or gals that are feeling well to come get anybody else sick. Mm-hmm. But I also want to know what it is. Mm-hmm. So I think the other part of that is that people, even their workplace, is kind of demanding an answer.
Yes.
As to what they've got. And you talked a little bit before we came in about, the things we could test for. Now, I think that's fascinating. Talk a little bit about, you said, one of the issues why we are all purple is that our surveillance and our tracking is so much better now because of COVID. This is one of the kind of good things from COVID, correct?
Yeah, there are some, and please don't call direct primary care associates and bless me out for this one, but there are some good things that came out of COVID.
Yeah.
Really. A lot of our tax dollars went into surveillance research and how do we track it? How do we keep this from happening again?
Yeah.
And so there are some good things. Now, what also came out of that is early diagnosis, early treatment. Now, what we were talking about just a second ago is the concomitant illnesses that are in there with that cough. And it's funny that you use that word cough. Like whenever somebody coughs now in a grocery store, everybody hears it.
I do it.
Right?
Oh, and isn't it even worse when you're the one that coughs?
Yes.
Like I literally, the other day, just I was sitting in a busy restaurant, packed out. It was on New Year's Eve. We're at a nice restaurant. Took a drink of my Coke Zero, went down the wrong pipe, coughed a little bit, and I was like, nope, just went down the wrong pipe. Like I was defending my cough. Oh. Like this isn't COVID.
Yeah.
Right?
Right.
That's where I am now.
Listen, I would love to give you a dark humor joke, but it's a public radio.
Yeah, but, it's good. It's a family show.
But I'll tell you that I did hear this one time, no joke. Guy coughs in a restaurant and screams COVID.
Yeah.
So, everybody kind of chuckled. But
Yeah.
but that being said, cough is what's bringing us in because we get worried. Like, what is it? What is the difference? And we'll talk about that. We're going to talk about, some of the signs and symptoms, the difference between the common cold and the common viruses,
Yeah.
and influenza and COVID,
Yeah.
and when you should go to the emergency room, when you should not go to the emergency room, when you should seek your healthcare provider, when you should treat yourself at home,
Well, listen, we've got a few minutes here before we got to take a break. So before we get into that, we'll get into that when we come back to the break. But first, I want to tell people, I want to get you folks out there to know who you got here. So this isn't just two guys I found on the street. These guys are the CEO and VP, respectively, of Direct Primary Care Associates. Brian is a provider. Tim is probably, if you've got primary care, direct primary care as a patient now, you probably met Tim, and that's probably how you became a patient, because that's how I became a patient. And I will give my full disclosure. I am completely biased. I can tell you guys personally, and I mean this from every bit of authenticity that I can, I have never had a better medical experience in primary care in my 47 years of life than since I made the switch a few years ago to direct primary care. Not only did I switch over to it, my fiance has switched over to it. We have insurance, folks. This wasn't to avoid insurance. This was because the standard of care that I have got and I've received, shout out to Stacy, love my girl Stacy. The standard of care that I have received there surpasses anything I've ever got. And that's not to say I haven't had some great doctors and practitioners here in the Cleveland area, but because it was run on that insurance model of fast food medicine, I was spending 2 and 3 hours, 4 or 5 hours away from work to go to the doctor to see my provider for maybe 10 minutes. Mm-hmm. And what you guys provide at Direct Primary Care is complete disruptor to the existing system. It's the reason you guys have been successful. It's the reason you guys are growing the way you are. But it's also the reason why, and for those of you that listen that own businesses, it's why I brought Tim in, and we've offered this as a benefit to all of our contractors that work for us, and why they've signed up for it, and they've signed their families up for it, and their spouses up for it. Folks, hear them out, listen to what it is. I promise you, you will not be disappointed, and you can't beat the price point for what they do and what they provide. So there's my little testimonial.
Well.
So,
and we're done.
Yeah.
Well, thank you for that, Dennis, and I appreciate that. And I know, Tim can speak to the business side of it, but the personal side. The last time I was on your show, we talked a little bit about it, and I talked to a nice lady who called and wanted to know more about it.
Yeah.
And she's like, well, I have insurance, and you touched on that. This isn't about insurance. This is really about healthcare. We have right on our website, we're the care, and we do it at a price point. And when we talk about that, what does that price get you? What is it? And we're a monthly membership-based primary care. We don't take insurance. We don't file insurance. You pay us a flat monthly rate, think Netflix,
Yep.
and you get complete access. When I say complete access, you get access to our office as many times as you want. You can come in and see us. No copays, no deductibles, no limits, no pre-existing conditions. There's nothing. We don't exclude anybody for any reason. On top of that, all the routine labs and the flu test, the strep test, all those things, they're included in that monthly membership. And then we also have our pharmacy too. That includes over 1,000 generic medications, which is absolutely unheard of.
Unbelievable.
And one of the first in the country. But, businesses out there, you mentioned businesses. I think, again, this is Tim's forte, not mine. So jump in there and tell us about what businesses.
We got 30 seconds, so I need a 30-second elevator speech. Go.
If you own a business of any size, all you need to do is call me. And I can give you more than the 30-second, but it's 423-650-3955. And my name's Tim Tatem. 80% of our clients among our 4 clinics are sponsored by their employers. And so it's a big part of what we do.
Well, that was perfect, by the way. Listen, we're going to come back. So, folks, these are real providers providing real service. We're going to come back. We're going to give you some tips. Every week we try to give you some tips on things you can do around the house, around the yard. Well, today we're going to give you some tips on what you need to be looking for. And, we're going to talk about some of these differences between the cold and some of these things to take care of yourself, take care of your family. I know kids go back to school this week. They just went back. Some of them are going back this following week. It's going to open up a whole new Pandora's box of fun and germs. So we'll be right back. Hang in there. Don't touch that dial. We'll be right back. You're listening to Home Solutions right here on Mix 104.1 and 101.3 The Buzz.
Are you tired of going to YouTube or Google for answers to your home improvement questions? Maybe you have more projects than you have time. No matter where you are in the process, Pro 93 Home Solutions is ready to serve you. Pro 93 is a local, veteran-owned company offering residential and commercial remodeling, cleaning, and security. Contact us today at 458-4135 or online at pro93homesolutions.com. Let the pros at Pro 93 find the solution for your home or business. That's 458-4135.
Welcome back, everybody. Hope you enjoyed that break. We're here with Brian Fretwell, Tim Tatem from Direct Primary Care Associates, talking about all things personal health here, folks. We're talking about today about keeping yourself healthy. A lot of sickness, a lot of virus going around out there right now. Direct Primary Care, if you heard right before the break, Tim and Brian did a great job of telling them a little bit about what they do and what they provide. So let's just jump right in. Brian, right now, people that are, we've got that COVID hangover. Mm-hmm. We're all scared about what's the next thing and the next virus. Flu's been around for as long as I can remember. I don't, flu's older than all of us, but all of a sudden it seems to be new emphasis on it. Mm-hmm. And I know you had said, now we can even track what kind of flu it is and you know exactly what we're fighting here. So for folks out there that are listening, cold or flu, when's it a time to go see? Because that's my fiance and I this week we're having this discussion. She started feeling icky, and I'm like, well, should you get in to see Stacy and try to get in front of it? And she's like, I don't know if it's that bad yet. When's the time when you should start making that call? I'm
going to make it real simple. Whenever you think you need to be seen, be seen. Don't wait.
Okay.
And we'll talk about, when that gets worse, okay? But go see your primary care provider. We love our patients at Direct Primary Care Associates, but this isn't a pitch for us. It's more of a pitch for take care of yourself. What are the things that you need to look for? And what are the differences between, say, flu, COVID, and just the common cold? I took a couple of notes, so we're going to read just a couple here.
Yeah.
So some of the signs and symptoms that people can have is an onset. Like, how fast does this come on? And I love it that you said, hey, kind of started with a cough, and then I started getting a sniffly nose, and then my throat's hurting, and now I got a little bit of a fever, and I kind of hurt.
Yeah.
So you always ask a question on your show. So I'll ask you the question.
Go ahead.
Is that the cold or the flu?
I don't know.
All right.
That's why I pay you. I have no idea.
So gradual onset is a cold. All right. Typically, the flu is rapid.
Oh, there you go.
Very, very rapid. Okay.
I feel good. Then I feel like I just had a cold then.
Right.
I did good.
So then fever. Does a cold have a fever? Well, sometimes it does, but it's not very common. So what is a fever? And listen, no offense to our listeners out there, but I get a lot. Yeah, I've ran a fever. Well, how high is it? Well, it was 99. Well, that's not really a fever to us. A fever is 101, 100.9 or higher. Okay. That's really a fever to us. So you can have a low-grade fever, doing air quotes for you guys out there. You can have a low-grade fever that 99 to 100 to 101 with a gradual onset with some other symptoms we'll talk about. That's a cold. A flu, rapid onset. Typically get a high fever really quick, sometimes even before any symptoms at all. Body aches, pains. And whenever you're sick, doesn't matter if it's strep, flu, cold, you're going to get some body aches and pains. And typically with a common cold, you're going to have some aches and pains. With the flu, it's going to feel really, really bad. Just all over. A lot of times it's in the shoulders and the neck and the legs. With COVID, it's all over. It feels like, man.
I felt like I got hit by a truck.
Yes. Mm-hmm. And backed up to see what they hit.
Yeah.
Chills. Chills are actually rather uncommon in a cold. You can have them, but they're not very common. So what are chills? Chills are rigors. Have you ever been so cold your teeth shattered?
Yeah.
Yeah, that's chills. Chills are not necessarily, oh my gosh, I feel so bad and I feel better when I bundle up. That's not really chills. Okay, so again, we as healthcare providers, we're listening to what people say, right? And people say, well, yeah, I absolutely have chills. Well, describe those to me. Well, I was really cold, so I bundled up. Well, chills are your teeth are chattering, you're under 10 blankets, you're sweating, and you can't get warm.
Yeah.
Okay? Fatigue and weakness, that sometimes happens with a common cold, but almost always happens with the flu.
Yeah.
Sneezing. Sneezing is very common with the cold and fairly uncommon with the flu. It does happen sometimes, but pretty uncommon. Chest discomfort and cough. Mild to moderate with, and this is the ambiguous part of the two. It's mild to moderate with a common cold, but it's pretty common with the flu. Okay, so you get that chest discomfort, feel like, oh,
Yeah.
I just can't catch we'll talk about not being able to catch your breath, but just feel like, man, if I could just get a good breath, but if I do, I start coughing. Stuffy nose is really common with a cold and sometimes happens with the flu. Headache is pretty rare with the cold and very common with the flu. So those are just some differences between the two right now. And so really what we're seeing a lot of, and we're testing a lot, but we're seeing a lot of flu type B, but we're seeing a lot more of rhinoviruses and adenoviruses and those other viruses that are out there. And believe it or not, there are COVID-19 is a variant of a coronavirus, but we're seeing some coronaviruses too. So, you know, when does it get bad? When does it like, okay, now, like, I've been taking my NyQuil, I've been taking my Dayquil, I'm taking the Tylenol, I'm taking ibuprofen, man, I'm getting worse. And this is that thought process when you ask me, when do I need to get help? That's when you need to get help. If you're doing everything that your healthcare provider has told you to do, you're doing everything your mother told you to do, right? You did everything your grandmother told you to do, and you're getting worse, you need to go seek help.
Yeah.
Okay? If your primary care provider is open, make sure you give them a call. Now let's talk about some of those emergency conditions when you just skip to the front of the line. These are the times that you really want to go to the emergency room when you know, hey, I listened to Dennis's show. Direct Primary Care was on there. They educated me on the difference between a cold and a flu. Now I know that I've got the flu, and I'm doing everything, and I'm getting worse. So what are some of those worst things? And really I want to talk about adults and children here too, but specifically adults. If you start having difficulty breathing or shortness of breath, just frank, like I can't breathe. I'm sitting here in my recliner, I'm laying in my bed, and I can't walk from here to the refrigerator or the toilet without getting short of breath, you need help.
Okay.
You need to go get help. Persistent pain or pressure in your chest or abdomen, you need to go get help. Now here's a good one. I mentioned seizures before, but seizures absolutely can happen, especially when your fever is so high that your body can't get it down. Your body does, and Control-Alt-Delete. Let's reset. Okay. So obviously, if you have seizures, or you just wake up completely passed out, you don't know what happened. If you're at home by yourself, and you're listening to this, and you're like, man, you know, I just woke up and I don't know what happened. You need to go be seen. Not urinating, which is a sign of dehydration. That's really bad. You need to be seen. Severe weakness or unsteadiness, like you're so weak you can't get up out of that chair, you can't get up out of the bed, or when you do get up, you feel like you're going to pass out. You got to hold on to something or sit there and try to get your balance. You need to be seen. But even worse, if you have chronic medical conditions, if you have diabetes, coronary artery disease, COPD, you have these plethora of problems that are getting worse because of the flu. And that does happen too. You can have worsening of your blood sugars. They can shoot out of the roof, and you can't get them under control with the medicines that you've got, that you're supposed to, your regular routine prescription medicines. You really need to be seen. So,
and one of the things that, you know, because I've had this question for myself, because in the past, I've been the guy that's been stubborn, and I've got to be losing a limb to go to the hospital. Mm-hmm. And so I was asking Stacy, I'm like, you know, when do I need to come see? And, you know, she's like, look, if you're taking, because you nailed it. I'm a Dayquil, NyQuil guy. I start feeling it come on, go get my pack of the orange pills and the maroon ones, and that's, you know, that's what I'm doing, right?
Sure.
That's my routine for a few days. She's like, if you're taking those and your symptoms are stopping for those 4 hours that you know till you take your next pill, she said, you're fine. You know, then you probably have a cold. That's probably, she said, not saying that's definite, but you know, if what you're doing is treating the symptom, you know, you're fine. But it's exactly what you said. It's when you get, when you're taking that and all of a sudden, boy, it's not touching this. Like I'm worse than when before I took it.
Absolutely.
And I think for a lot of folks, I feel like, and I'm being completely stereotypical here because I'm a guy, but like as guys, I can tell you, COVID has made me more likely to go to a doctor.
I'll tell you something, Dennis, and maybe some of your listeners will appreciate this. I have a lot of patients and a lot of people that we see because we do take care of businesses, and we see especially men who don't normally come otherwise, and they don't trust us. They don't trust the medical establishment, and they actually come less because of COVID. So that scares me too on the other side of that. Well, you say, hey, I come more. I'm actually seeing people who actually come less.
Oh, gosh.
You know, as you're sitting here listening to us at home, you know, please understand, we're here to help. We're not. I can tell you that we're not a part of some cabal that's trying to keep people sick. I assure you.
You're not part of Fauci's army.
No, not lately.
No. So the other thing, one of the things you said, you mentioned this because I know this was a problem at a couple of our local schools here, was an outbreak of strep. What's some of the things that set strep apart, kind of separate? Because I know from what I understand, extremely contagious.
It is.
And so you can get these pockets, and it can be in one school and not in another, in one church, one area. Anytime there's a big conglomerate of folks, what's some of the things, the signs that set strep apart?
So strep is a good one, especially in children. Typically, if a child has had strep before, they're often a carrier. And as we get older, our immune system strengthens, and we have the ability to carry it and not really bother us. Children, though, especially, some of the signs and symptoms are headache, decreased appetite, upset stomach, nausea, vomiting, diarrhea. And those are, I'm telling you, the things that most people don't look out for as far as strep goes. Decreased appetite. Their throat hurts. When you touch the front of their throat hurts, but they have these big swollen lymph nodes in the front.
Yeah.
And the mom touch is always true. If mom says, "Hey, I touched my son's throat or my daughter's throat and it's swollen," and a lot of times that is strep. When you look in the back of their throat, the best way I know how to describe it is everybody's probably seen mold on bread.
Yep.
You look in the back of their throat with the mommy or daddy flashlight, and it looks like mold on bread.
Yeah.
Now, again, it's not 100%. There are some other conditions that can cause that, but this is why you go see your healthcare provider.
Yes.
You come to Direct Primary Care Associates or whoever your PCP is and get that tested or looked at to make the difference. Now, some late signs or other signs that you may not think about is fevers. You can get those 101, 102 fevers and a rash on the body. Now, a lot of viral illnesses causes rash, but especially with a strep rash, when you touch it, it feels like sandpaper, like very fine sandpaper. You're touching your child's arm, leg, chest, and wow, that feels like sandpaper. This doesn't feel like my baby's skin. And you look a little closer, like, oh, I see a rash. That's a pretty fair indicator of strep.
And one of the things that's always been for us, because I've got two daughters that we pass strep around like crazy, but the nausea part,
that's a big one.
That's one of those things. It's like you can kind of just nail it. Like, oh, throat's getting sore. Maybe she got a cold. Like, oh, my stomach. I'm just, they don't have an appetite. And their stomach, everything's up. And I'm like, we need to go get somebody to shine a flashlight in the back of her throat, because that sounds like strep. But it's crazy how especially with kids. So going back to school right now, for parents out there, your kids are going back. They're going to be around everybody else. You can't do anything about what anybody else is doing. What are some tips folks can do with their kids, getting them ready to go back? Just things they need to keep in mind as far as, are we still doing hand sanitizer? Or are we doing what do we need to do these days?
The answer is yes. Well, listen, I've got a 17-year-old daughter at home, and she got mono, and there's mono around as well. And so I run down the list. You asked me a question, and I run down the list. You wash your hands? Yes, washing my hands. Staying out of people's face? Yes. Not sharing chapstick, lipstick, things like that. Oh, no, that's gross. Sharing drinks with anybody? So that's one of those. Okay, coughing, sneezing, shaking hands. What I would tell your kids is this: keep a fair distance away from anybody that is sick or could potentially be sick. There are a lot of kids who parents don't even know they're sick, and they show because. Kids are really resilient.
Yeah.
And they, you can be sick for, up to 24 hours with the flu, strep, all these things before you show any symptoms. So, fair distance. Wash your hands a lot. Use hand sanitizer. Wash your hands every chance that you get. Keep a fair distance. Don't share drinks. Don't share chapstick, lipstick.
There we go. There we go. With my daughters, don't share the chapstick.
Yeah,
there we go.
It happens. It happens. But unfortunately, out of all this, there is no 100% prevention. Immunizations, especially with flu, are still recommended. Okay, and that's the first line of defense. But the biggest thing is be smart. Get treated quickly. Treat yourself quickly. Don't wait. Don't sit around and wait. Don't let things get worse, because the worse that they get, the harder it is for us to catch up and get you better.
Folks, I couldn't end the show any better than that. Take care of yourself out there. Man, Brian, Tim, thank you guys so much for being here. One thing I can tell you, we didn't even talk about, but if you want another reason to give them a call at Direct Primary Care, and how can they get a hold of you, Tim?
423-650 3955 is my personal cell line. And our website's directpca.com.
There you go. Give them a buzz, because if you do need to get seen, you don't have to wait weeks to get in to see when the next time the doctor has an opening or get on a cancellation list. What's your guys' right now? You guys are next day, 2 day, within the next 2 days, you guys can get people in?
Usually next day.
Usually next day appointments, folks. Don't wait. Listen to what Brian just said. Take care of yourself. Take care of your family. If you feel like it needs to be seen, go do it. Like I say every week, folks, go home, love on your family, love on your neighbor, and remember, we're all in this together. We'll see you guys next week. Thank you guys so much for being here.
Thanks for having us.
You've been listening to Home Solutions right here on Mix 104.1 and 101.3 The Buzz.